I thought I would just start out by saying a few words about the book and sort of describing some of those questions that are so central to it and some of the places where those questions took me. And I'll read a few moments from the opening essay as well. So my book of essays is called The Empathy Exams. And that title comes from the work that Ellen mentioned, my work as a medical actor, when I evaluated the displays of affective care I got from doctors in training, medical students. And that got me started thinking about what empathy really is. So in that sense, the empathy exams were being taken by those doctors in training. But I also started to think of the collection as a series of exams insofar as I was testing myself and my own capacity for empathy as a journalist and a traveler and a human being. The essays range all over the map, geographically and emotionally. One essay, as mentioned, examines Morgellons disease, a controversial skin disorder, and the close-knit community that has formed amongst those who believe themselves to suffer from it. In that piece, I was thinking about what it might mean to empathize with people when you believe in the fact of their suffering, but not necessarily with their understanding of its cause. Many of the essays are about some kind of voyeurism. What does it mean to take a tour of a Bolivian silver mine and witness the horrendous working conditions there? What good does that do anyone? What does it mean to take a bus tour through gang territory in Los Angeles? Do these facilitate empathy or offer a cheap simulation of it? How can someone possibly understand the emotional toll of incarceration without being incarcerated? How can someone understand why another person would voluntarily choose to run 125 miles through brutal wilderness? In that case, the question was sharpened for me by the fact that the other person was my brother, and sometimes the same genetic materials go to very different places. I look at the mystery of how we access each other's lives and each other's pain. Some of the essays are something like memoir. I look at my own life. Some are more like journalism. I look at the lives of others. Some are criticism. I look at writing or art. Most are some combination of these modes of inquiry. My writing is explicitly about empathy, but I also think that all writing is about empathy, or it should be. I've worked as a journalist and an essayist and a novelist, and to me, those writing practices all demand very different kinds of empathy, almost sometimes opposite kinds of empathy. Writing a novel means imagining the existence of another person. Being a good journalist means listening to an experience instead of imagining it, trying to keep your own narrative at bay so you can hear the voice of another. I think that all acts of empathy involve some combination of listening and imagining without making assumptions, without co-opting the narrative. And so I started in certain ways to think about fiction writing and reported work as not necessarily embodying two opposite acts, but illuminating two very different facets of what empathy always is. And the first time that I really started thinking about empathy as something that you could almost break down or dissect into component parts was when I was working as a medical actor. And in that context, empathy wasn't just some kind of nebulous abstraction. It was something that could be measured and graded. It made me think about my own experiences as a patient. How and where had I experienced empathy? When had I gotten something else? What had that felt like? So I'm going to read from the opening pages of the book where I describe that work as a medical actor, sort of the logistics of it, and then some of the bigger questions that it raised. My job title is medical actor, which means I play sick. I get paid by the hour. Medical students guess my maladies. I'm called a standardized patient, which means I act toward the norms of my disorders. I'm standardized lingo SP for short. I'm fluent in the symptoms of preeclampsia and asthma and appendicitis. I play a mom whose baby has blue lips. Medical acting works like this. You get a script and a paper gown. You get $13.50 an hour. Our scripts are 10 to 12 pages long. They outline what's wrong with us, not just what hurts, but how to express it. They tell us how much to give away and when. We are supposed to unfurl the answers according to specific protocols. The scripts dig deep into our fictive lives, the ages of our children and the diseases of our parents, the names of our husbands, real estate and graphic design firms, the amount of weight we've lost in the past year, the amount of alcohol we drink each week. My specialty case is Stephanie Phillips, a 23-year-old who suffers from something called conversion disorder. She is grieving the death of her brother, and her grief has sublimated into seizures. Her disorder is news to me. I didn't know you could have a seizure from sadness. She's not supposed to know either. She's not supposed to think the seizures have anything to do with what she's lost. Our simulated exams take place in 3 suites of purpose-built rooms. Each room is fitted with an examination table and a surveillance camera. We test second and third year medical students in topical rotations, pediatrics, surgery, psychiatry. On any given day of exams, each student must go through encounters, their technical title, with 3 or 4 actors playing different cases. A student might have to palpate a woman's 10 on scale of 10 pain in her lower abdomen, then sit across from a delusional young lawyer and tell him that when he feels a writhing mass of worms in his small intestine, the feeling is probably coming from somewhere else. Then this med student might arrive in my room, stay straight-faced and tell me that I might go into premature labor to deliver the pillow strapped to my belly, or nod solemnly as I express concern about my ailing plastic baby. He's just so quiet. Once the 15-minute encounter has finished, the medical student leaves the room and I fill out an evaluation of his/her performance. The first part is a checklist. Which crucial pieces of information did he/she manage to elicit? Which ones did he/she leave uncovered? The second part of the evaluation covers affect. Checklist item 31 is generally acknowledged as the most important category. Voiced empathy for my situation/problem. We are instructed about the importance of this first word, voiced. It's not enough for someone to have a sympathetic manner or use a caring tone of voice. The students have to say the right words to get credit for compassion. We SPs are given our own suite for preparation and decompression. We gather in clusters. Old men in crinkling blue robes, MFA graduates in boots too cool for our paper gowns, local teenagers in ponchos and sweatpants. We help each other strap pillows around our waists. We hand off infant dolls. Little pneumatic baby Doug, swaddled in a cheap cotton blanket, is passed from girl to girl like a relay baton. Our ranks are full of student actors and undergraduate drama majors seeking stages, high school kids earning booze money, retired folks with spare time. I am a writer, which is to say, I'm trying not to be broke. We play a demographic menagerie, young athletes with injuries and business executives nursing cocaine habits. STD grandma has just cheated on her husband of 40 years and has a case of gonorrhea to show for it. She hides behind her shame like a veil, and her medical student is supposed to part the curtain. If he's asking the right questions, she'll have a simulated crying breakdown halfway through the encounter. Blackout Buddy gets makeup, a gash on his chin, a black eye, and bruises smudged in green eyeshadow along his cheekbone. He's been in a minor car crash he can't remember. Before the encounter, the actor splashes booze on his body like cologne. He's supposed to let the particulars of his alcoholism glimmer through, very unplanned, bits of a secret he's done his best to keep guarded. Our scripts are studded with moments of flourish. Pregnant Lila's husband is a yacht captain sailing overseas in Croatia. Appendicitis Angela has a dead guitarist uncle whose tour bus was hit by a tornado. Many of our extended family members have died violent Midwestern deaths, mauled in tractor or grain elevator accidents, hit by drunk drivers on the way home from grocery stores, felled by a Big Ten tailgate, or, like my brother Will, by the aftermath of its debauchery. Between encounters, we are given water, fruit, granola bars, and an endless supply of mints. We aren't supposed to exhaust the students with our bad breath and growling stomachs, the side effects of our actual bodies. Some students get nervous during our encounters. It's like an awkward date, except half of them are wearing platinum wedding bands. I want to tell them I'm more than just an unmarried woman faking seizures for pocket money. I do things, I want to tell them. I'm probably going to write about this in a book someday. We make small talk about the rural Iowa farm town I'm supposed to be from. We each understand the other is inventing this small talk, and we agree to respond to each other's inventions as genuine exposures of personality. We're holding the fiction between us like a jump rope. One time, a student forgets we are pretending and starts asking detailed questions about my fake hometown, which, as it happens, if he's being honest, is his real hometown. And his questions lie beyond the purview of my script, beyond what I can answer, because in truth, I don't know much about the person I'm supposed to be or the place I'm supposed to be from. He's forgotten our contract. I bullshit harder, more heartily. That park in Muscatine, I say, slapping my knee. I used to sled there as a kid. Other students are all business. They rattle through the clinical checklist for depression like a list of things they need to get at the grocery store: sleep disturbances, changes in appetite, decreased concentration. Some of them get irritated when I obey my script and refuse to make eye contact. I'm supposed to stay swaddled and numb. These irritated students take my averted gaze as a challenge. They never stop seeking it. Wrestling me into eye contact is the way they maintain power, forcing me to acknowledge their requisite display of care. I grow accustomed to comments that feel aggressive in their formulaic insistence. That must really be hard to have a dying baby. That must really be hard to be afraid you'll have another seizure in the middle of the grocery store. That must really be hard to carry in your uterus the bacterial evidence of cheating on your husband. Why not say, I couldn't even imagine? Other students seem to understand that empathy is always perched precariously between gift and invasion. They won't even press the stethoscope to my skin without asking if it's okay. They need permission. They don't want to presume. Their stuttering unwittingly honors my privacy. Can I, could I, would you mind if I listened to your heart? No, I tell them, I don't mind. Not minding is my job. Their humility is a kind of compassion in its own right. Humility means they ask questions, and questions mean they get answers, and answers mean they get points on the checklist. A point for finding out my mother takes Wellbutrin, a point for getting me to admit I've spent the last 2 years cutting myself, a point for finding out my father died in a grain elevator when I was 2, for realizing that a root system of loss stretches radial and rhizomatic under the entire territory of my life. In this sense, empathy isn't just measured by checklist item 31, voiced empathy for my situation/problem, but by every item that gauges how thoroughly my experience has been imagined. Empathy isn't just remembering to say, that must really be hard. It's figuring out how to bring difficulty into the light so it can be seen at all. Empathy isn't just listening, it's asking the questions whose answers need to be listened to. Empathy requires inquiry as much as imagination. Empathy requires knowing you know nothing. Empathy means acknowledging a horizon of context that extends perpetually beyond what you can see. An old woman's gonorrhea is connected to her guilt, is connected to her marriage, is connected to her children, is connected to the days when she was a child. All this is connected to her domestically stifled mother in turn and to her parents' unbroken marriage. Maybe everything traces its roots to her very first period, how it shamed and thrilled her. Empathy means realizing no trauma has discrete edges. Trauma bleeds out of wounds and across boundaries. Sadness becomes a seizure. Empathy demands another kind of porousness in response. My Stephanie script is 12 pages long. I think mainly about what it doesn't say. Empathy comes from the Greek empatheia, into, and pathos, feeling, a penetration, a kind of travel. It suggests you enter another person's pain as you'd enter another country, through immigration and customs, border crossing by way of query. What grows where you are? What are the laws? What animals graze there? So through the process of writing both that piece, thinking about the experience of being somebody who was essentially grading empathy, and then through a variety of different acts of exposure, the ones that comprise the book, I did start to see empathy less as a vector pointing in one direction and more as a series of tensions, something perched, as I say, between gift and invasion, between intention and intuition, between imagination and inquiry, between assertion and humility. And it was that really started to fascinate me, this way that empathy seemed to be comprised of these contradictions, and that it started to seem like something that could do harm alongside good, or a space where good intentions could actually do some kind of damage. And I'd say over the sort of looking back over the course of writing the book, I'd say that my thinking about empathy evolved in two big ways. And one was precisely that I stopped seeing empathy as immaculate or flawless or wholly good, and I started to see it as something wonderful, yes, but also something full of perils and pitfalls, that there was a real danger in assuming or imagining too much about the experience of somebody else. And I also stopped sort of glorifying empathy as something entirely intuitive or unwilled. I think that we could glamorize the sort of sense of feeling for another person instinctively, like almost like a reflex, in the same way that we can glorify a vision of art that just like descends on you from the muse. But I started to really think about how empathy might also come from a series of choices, and how what seemed like just a sort of hollow pattern of going through the motions, this sort of way that doctors were learning a script of how to care for people, that initially it seemed so entirely hollow to me and so entirely false. But I started to think about what actually could be the value in some kind of script, and that might liberate us from doing simply what we felt like or what we felt comfortable with in any given moment. And so I started to think about, well, what kind of value might going through the motions actually have? I started to gain this increased faith in intentionality, empathy, not just as passive experience, but as intentional choice. It's easy to find that formulaic role play hollow, that must be hard, etc. But I respected the ethos beneath those guidelines, and the notion that we might follow a set of behaviors rather than relying on what feels most intuitive or comfortable in all moments. And I'm just going to read one more moment from the essay, and then I'm going to stop talking and get into conversation. So this is from near the end of the first essay. Empathy isn't just something that happens to us, a meteor shower of synapses firing across the brain. It's also a choice we make to pay attention, to extend ourselves. It's made of exertion, that dowdier cousin of impulse. Sometimes we care for another because we know we should, or because it's asked for, but that doesn't make our caring hollow. The act of choosing simply means we've committed ourselves to a set of behaviors greater than the sum of our individual inclinations. I will listen to his sadness, even when I'm deep in my own. To say, going through the motions, this isn't reduction so much as acknowledgement of the effort, the labor, the motions, the dance, of getting inside another person's state of heart or mind. This confession of effort chafes against the notion that empathy should always rise unbidden, that genuine means the same thing as unwilled, that intentionality is the opposite of love. But I believe in intention, and I believe in work. I believe in waking up in the middle of the night and packing our bags and leaving our worst selves for our better ones.